I am completely and unalterably opposed to the sort of proposals you've seen from the President administration and their allies in Congress. Let me mention three main reasons I am so completely opposed to those proposals, and three proposals I have been advancing to improve health care. First of all, in terms of the Obama proposals. Number one big concern is his so-called government option, and my belief that in a few years this government option would become the dominant option or the only option and would have government-run health care. That's the last thing I want for this country. Point number two, cost. All of these proposals have been estimated to cost between $2.2 and $2.4 trillion with a T over 10 years of full implementation. That's an enormous burden and an enormous cost. That's on top of the $1.8 trillion of debt this liberal Congress has already created this year. That's on top of a budget they passed over my objection that doubles that very high level of debt in 5 years and triples it in 10. And those first 2 points lead to my point number three. There would be enormous pressure under that plan to pay for those costs, to somehow cover those costs. And I believe that pressure would lead to exactly what it has led to in countries like Great Britain and Canada, which is delay and denial of care, essentially rationing. And I'm completely opposed to that. We need to deal with cost. We don't need to deal with it by having a government bureaucrat deciding what treatment you can and can't have. And that is absolutely the case in Canada. Three things I support. One is association health plans, allowing small businesses to band together nationally across state lines to buy insurance coverage and get a much better deal because there's strength and a better deal in numbers. Second is reimportation of prescription drugs, allowing all of us as Americans to buy safe, cheaper prescription drugs from other countries and thereby lower drug costs in this country, break down the system that allows the big drug companies to charge very different prices in different countries. Of course, we pay the highest prices by far. And the third idea I'm pushing very hard is a much greater focus on preventative medicine and healthy living, and to build in concrete money incentives into all of our plans to encourage us, not mandate us, to encourage us to move in that direction. That's an enormous area where we can save money, particularly if we more effectively deal with big issues like smoking and obesity, which are the two biggest single causes of driving up healthcare costs. So those are some of my ideas. In Congress, all of this is being debated. My biggest goal in the last month has been to make sure that we didn't pass any health care plan until the August recess, which we're in right now, so members could listen to their constituents across America. And we accomplished that first goal, which I think is very important.